In the United States, hunger is on the rise. Approximately 1 in 6 Americans live in a state of sustained hunger or food insecurity, which means that they don't have adequate access to food to keep healthy, and this is associated with adverse academic and social outcomes.
This means that 42.2 million Americans live in food insecure households, including 29.1 million adults and 13.1 million children. 1 in 7 American households could not buy adequate food last year due to the lack of money or other resources.
Within the 14% of people who live with food insecurities, 48% of these households were of African American or Hispanic descent. Only 2% of households are considered by the U.S. Department of Agriculture to live in food deserts. So the problem isn't the access to food as much as not having the money to pay for it.
Unlike requirements for oxygen and water, people can potentially live up to 70 days without food. Your body has the physiological and metabolic defenses to keep you alive.
Did you know that at the age of 74, Mahatma Gandhi lived for 21 days without eating food during a hunger strike?
Yes, this is possible because starvation is a prolonged process in which our bodies experience metabolic modes that allow for the conservation and reallocation of energy.
So essentially, after we eat, our body breaks down the energy stores into usable glycogen forms. Although when our glucose stores get depleted, our body resorts to other forms of energy, such as protein and muscles. Vitamin deficiency is a common result of starvation and may lead to anemia, beriberi, pellagra, and scurvy.
And eventually, the lack of vitamins and energy will eventually weaken your immune system. Premature death can be caused by immune system deficiencies or diseases resulting from severe energy or protein deficiencies, which also pave the way for infections.
One of these diseases is called kwashiorkor and is common among children in the tropics. It is caused by protein deficiency in the diet and results in delayed growth, a swollen belly, and frequent infections.
The other typical disease is called marasmus and results from severe undernourishment, causing a child's weight to be significantly low for his or her age. The general symptoms are chronic diarrhea, dizziness, and fatigue. But there's a cure. Do you know what it is?
What?
What?
Just a change in diet with better nutrition. So simple.
Food insecurities weaken a person's ability to effectively make use of any medications for any other health problems. As a result, the problem escalates to almost every other health complication, as many medications require to be taken after consumption of a meal.
So now that we've covered the basics, let's get a few things straight.
Okay, so number 1. It's a myth that people are hungry because of scarcity.
Number 2, it is a myth that hunger results from overpopulation.
Number 3. It is a myth that the solution to hunger is growing more food. The truth is that there is more than enough food to feed everyone, and every country in the world has the resources needed for its people to free themselves from hunger.
Regardless, a lot of people may have food, but they are often not eating high quality food. And in fact, 57% of participants in a study of 200 mothers from daycare centers in Rhode Island from 2009 to 2011 reported eating at least once during the previous week at fast food restaurants. This is a huge problem, so it is important to address some of the social issues that arise from hunger in the United States.
While hunger is not a visible illness, it is not difficult to see the effect it has on other areas of public health. Hunger is a key factor in the United States, having the worst infant mortality rate among developed countries. This means that thousands of infants die each year in impoverished communities across America due to food insecurity alone.
It was also found that cigarette smoking is positively correlated with food insecurity. Hunger is associated with increased cigarette smoking among adults in the United States, and food insecurity is consistently higher among smokers than non-smokers.
The prevalence of smoking declined more slowly in food insecure households, indicating that more low income smokers face hunger, which may partly be due to buying cigarettes. Therefore, it begs the question, would improving food insecurity lead to higher smoking quit rate or vice versa?
By decreasing food insecurity rates, other public health issues facing Americans could be greatly improved.
Food insecurities are associated with negative effects on academic performance and social outcomes of children. Children need to be nourished and with high quality food in order to develop properly, and when their nutritional needs aren't met, it can adversely affect how well they perform in school. Their brain doesn't develop as well as it could have if they grew up eating enough healthy food. As a result, these children are also more likely to be aggressive and to develop depression. It goes beyond just the physical well-being of the child. It starts affecting their social and academic life.
Food insecurities affect nutritional, behavioral, and the mental health of HIV patients as well. Food insecurity affects the antiretroviral therapy of these patients, which is one of the main treatments available for fighting this disease. It also causes patients' mental health to be affected through depression and substance abuse. All of these effects contribute to a higher morbidity and mortality of HIV patients living with food insecurities.
Healthcare and hunger are very much linked because you cannot be able to fight off chronic diseases if you are not eating a sufficient amount of healthy foods. In order to eliminate food insecurity and improve the overall health of the nation, poverty itself must first be addressed. So, what do we need to do?
We need equal access to proper education, equal job opportunities, satisfying work options, and adequate pay. By improving these things, we can increase a person's ability to provide enough food for themselves and their family. What else can be done on both federal and local levels?
They can improve and promote the Supplemental Nutrition Assistance Program, formerly known as food stamps, by adjusting the income level for food stamp eligibility. Establishing universal free school meals could also improve public health by removing the stigma associated with free meals and increasing nutritional and social education in schools.
So, do you want to make a difference?
Yes, but what can we do?
There are so many resources out there that you can utilize to help save lives. Volunteer at soup kitchens, encourage your school to get involved in fundraising and food donations. But right after this PSA, be sure to log on to freerice.com. You can sit and answer questions from the comfort of your own home, ranging from different subjects and difficulty. And for each answer you get right, they donate 10 grains of rice through the World Food Program to help end hunger.